Our first guests today are Dr. Phillip Khan of Novant Health Coastal Plastic Surgery and one of his patients, Sue MacCallum. Dr. Khan, Sue, what a pleasure to have you on the show today.
Thank you.
Thank you. It's great to be here.
Yes.
It seems like just the other day we were talking, Phillip. I think a couple months ago you were on the show.
I believe that we were. Yes,
But there may be somebody out there who hasn't seen that show or just missed it. So tell us a little bit about yourself and your practice.
Good. Well, I'm a local young man that was raised here that has come back and become a plastic surgeon in the area that practices at Novant Health Brunswick Medical Center.
And we're so happy you did.
I'm happy to be back.
Sue, tell me a little bit about yourself.
I've been in Brunswick County for, about 20 years now. My husband and I moved here in the late 1980s. I think I'm right about that. And we've been very active in the community. Jim does some work here at ATMC, my
Yes,
hometown.
he has a show too. Yeah.
And I've been active in Brunswick Little Theater for
You
a
are
number of
very
years.
active
So
in Brunswick Little Theater.
I've been very busy.
You do a great job there.
Oh, thank you. Thank you so much.
I'm sure that keeps you really busy.
Yeah.
So you probably didn't have time to have all this happen to you, did you?
No, it was a surprise.
It was a surprise.
Oh.
Yes, I'm sure it was, and not a real pleasant one either. Let's start by hearing your story as a breast cancer survivor.
Yes, I'm a breast cancer survivor back from about 7 or 8 years ago, and I've had a recurrence. It took really a different form because the second time around it was on the surface of the skin where I had had a breast removed, and slightly unusual for that to happen. But the wonderful thing is that Novant has a wonderful group of doctors, and I had some of them before, but in the old building, so this is just like paradise to be treated at Novant. But Dr. Khan is so incredible, and his skills in the reconstructive surgery have been wonderful for me, because that's what it took really to, and I know he can talk much more technically about those things than I can, but I am just very fortunate to have the outstanding
We are too. We're very happy
physicians
to have
here,
you
and
here.
particularly Dr. Khan.
But I do have one question for you. How did you find Dr. Khan? How did you hear about it?
You know, it was through the first contacts I had with the hospital when the recurrence was my oncologist and the people in radiation. I mean, everybody said, Dr. Khan is the one. Dr. Khan is the one that can really help you with your particular kind of cancer and the surgery that would be needed. So that's how I heard about him. And I also heard about Kelly, too, his nurse, from different people. And I just couldn't be happier, and my whole family is just so grateful.
Well, we're so happy that you're here.
Thank you.
And so happy that you did find a Dr. Khan and that you were steered in that direction. That's wonderful. Dr. Khan, I would like for you to talk a little bit about the surgery, because it seems pretty unique. It seems a little different, and so maybe you can share that information with our viewers.
This was a good example, and it was unique from our basic breast reconstruction type patient. Typically, as the plastic surgeon, the breast reconstruction involves making new breasts out of what has been removed after something such as a mastectomy to treat the cancer.
Right.
What is unique in this situation is that, as we had talked about, she had a recurrence on the skin around an old site of cancer. In that realm and in that type of a situation, we moved towards not just reconstruction of the area of the breast, but reconstruction of the chest wall itself. And it's a really unique situation and highlights what we have at Novant Brunswick Medical Center due to the fact of how multidisciplinary the expertise was to come up with such a complex plan, particularly in someone who had had a recurrence almost 10 years out from surgery. It highlighted the skills that we have in terms of Dr. DeSandre, who was a resecting general surgeon in the area, And the combined efforts that we really come up with a detailed plan with our tumor board and working with our medical oncologists, working with our radiation oncologists, to first come up with the diagnosis. Second, ensure that we're getting the proper treatment of the cancer, which is first and foremost. And then interplay that with the reconstruction, which can be both beneficial in terms of form, function, as well as healing post-operatively in something such as a situation like this.
So help me to understand, initially the surgery began with a general surgeon, Dr. DeSandre.
Yes.
And then you were there by his side
Yes.
for your portion of that surgery. How long does a surgery like that take?
Surgeries such as that can take anywhere from 2 to 3 hours to on upwards of 10 to 12 hours, depending upon what we encounter. We knew that we were going to have a defect of not only skin but also chest wall after the surgery. And it's a complex decision tree in order to figure out how we're going to close the area as well as treat the cancer in the process. Other parts of the planning following that come into play, whether someone will need chemotherapy afterwards, which is the help of the medical oncologist, or whether someone will need radiation therapy afterwards in order to help treat the area once we've removed the cancer itself.
And so, Sue, are you currently receiving radiation?
Yes, excuse me, I'm in my second week of radiation, and that's another example, I think, of just great teamwork too, and communication. And all of the doctors have said how much that they have enjoyed working together, especially with Dr. Khan. And so I think that is so important, to have it all sort of nestled around a hospital like Novant.
You seem like you feel like you've had the best care possible, and you
I
seem
really
so
do.
comfortable with everything that's gone on in such
Yes.
a terrible situation, but you've got...
Well, it's just, there's a lot of joy in having relationships
Wow.
with the team and nurses as well, and people like yourselves. I just can't say enough about Novant as a professional
That's
care.
What a great
community.
story. Well, how do you feel about the cosmetic look of the surgery? How are you?
Well, it's a little different looking, and as I told Dr. Khan one time, I love patchwork quilts, so I definitely have some of that going on here and there. But I honestly, I look at it as a work of art. I really do, and I see Dr. Khan.
Knowing you, I can
Well, yeah,
understand where you're
right.
coming from, because you would see something
I
like
did
that.
tell Dr. Khan one time that he's like a Michelangelo, because he honestly, he loves what he does. He works tirelessly at what he does. He really loves it, and he has a wonderful personal relationship with his patient, very personable, much more than I've ever been blessed with before, because it's pretty horrific news to find out that I had a second bout, more complicated than before with cancer.
Yeah.
So it has been an incredible, and is an incredible experience.
Dr. Khan, I have a question about radiation and after surgery like that. Does it affect the healing process, and can that cause other issues?
Radiation can cause other issues many, many years later in terms of the possibility of even inducing some things on the skin afterwards. Acutely, quite a lot of people will have some type of skin changes with radiation, almost like a little superficial sunburn. Some people get that, some people do not get that afterwards. But typically people have a pretty good course afterwards, particularly in something as treatment after radiation for breast cancer, such as this.
Oh, what would be the next steps for now? What happens in her journey from a medical perspective? What happens?
So from a medical perspective, part of the complex planning that we have, our number one, we've gone through the journey of really treating the cancer. We've gone through the journey of planning how we were going to treat it, interplaying with that, how we were going to reconstruct it. Then from that, how we were going to treat and keep chances of recurrence happening again. And that's where the radiation can play in part. Now, once we're finished with all of our radiation, then it's surveillance from that point on, really, to decide what we really want to do and just look at the skin and do any type of fine tuning that we may have to do afterwards. This was a complex chest wall reconstruction. There are options down the line in the future should we choose to do something like a full breast reconstruction, even with implants, at a later time. Part of our reconstruction that we had worked so hard on was not only being able to cover the defect, but providing a reconstruction that would actually protect the chest from the radiation, particularly on someone that's so small a frame. And that's a highlight of all, just the complex thinking that we had to go into this at our hospital. It highlights just the system itself of what we've got here.
Well, this was a difficult subject, and I'm so appreciative that you were able to come and tell your story.
Oh, I thank you.
Sue, it's been very
Jan.
inspirational to me. And Dr. Khan, thank you so much for sharing the medical side of this information. We wish for you the very best, Sue.
Thank you.
We will
Thank
keep
you
you
so
in our
much.
thoughts and prayers, and thank you so much to Dr. Khan for everything that you've done for her. And we're going to keep tabs on you, and we hope to talk real soon, and you got to keep us posted on how you're doing.
Thank
and
you.
I'll see you at Rotary, but
Yes.
we'll talk.
Thanks so
We'll
much,
talk soon.
Jan.